All of us at Washington Hospital are deeply committed to a culture of quality and safety. Healthcare is an intensely personal service. Our reason for being begins and ends with our patients and our community.
With this newly amended mission statement, should the board choose to pass it this evening, it will be clear to everyone in the hospital that patient safety and best practices are not a project or a goal, but it is instead an intrinsic value of the hospital healthcare system.
We have a motion and a second. All those in favor?
Aye.
Aye. Opposed? Motion passes.
Washington's commitment to quality as a core value has been underscored by the language recently added to our mission statement. The new language makes our emphasis pretty clear, committing to a culture of patient safety and accountability, and adopting identified best practices. Of course, quality and patient safety have always been among our top priorities. After all, it's an integral element of our patient-first ethic. Quality is part of everyone's responsibility at Washington Hospital. There are experts within the hospital who focus solely on this issue. As chairman of Washington Hospital's Quality Steering Committee for many years, I meet with medical staff and hospital employees monthly to review quality improvement initiatives and discuss measurement of outcomes. Our quality efforts focus on three major areas: patient safety, medication safety, and evidence-based practices. Washington Hospital's long-standing commitment to providing our patients the best, safest, and most effective care will never change. Our emphasis on patient safety shows in the way our doctors interact with patients and in our impressive ratio of registered nurses to patients, and in careful procedures such as using 2 identifiers for each patient to ensure the correct identification. Another example of Washington Hospital's commitment to patient safety is our early adoption of cutting-edge technology that reduces the time for detection of antibiotic-resistant staph infections from 2 to 3 days down to less than 90 minutes. Early detection is the key to providing effective treatment and to prevent the spread of these dangerous infections. Medication errors are the most common healthcare mistakes. We help to reduce the risk of those errors in a number of ways. A medication safety committee, chaired by CEO Nancy Farber, focuses on assessing, monitoring, and improving our systems and processes. A full-time medication safety officer dedicated to constantly evaluating and improving the medication delivery process. To support these efforts, the hospital has invested in the latest technology for improving the accuracy of dispensing medication. Evidence-based practices means applying the results of scientific research to real-world patient care. We're doing this in a number of ways here at Washington Hospital. For example, research has shown that elevating the head of a patient's bed to an angle of 30 degrees when applied as part of a comprehensive bundle of care significantly reduces the risk of pneumonia among patients on ventilators, a serious problem in hospitals. In 2006 and 2007, Washington Hospital went 420 days without a single case of ventilator-associated pneumonia, due in large part to the application of evidence-based practices. Another example of evidence-based practices is the prevention of central line infections, potentially deadly bloodstream infections that sometimes occur in patients receiving medications or fluids intravenously. Through the application of a systematic regimen including proper hand hygiene, sterilization procedures, and checking the line for infection each day, Washington Hospital has gone 732 days without a central line bloodstream infection. The widespread implementation of evidence-based practices was a major focus of the 100,000 Lives campaign, and Washington Hospital was an active participant in this nationwide effort. Led by the Institute for Healthcare Improvement, or IHI, more than 3,000 hospitals worked to reduce the number of preventable deaths and injuries in hospitals. In the first 18 months, a projected 122,000 lives may have been saved throughout the United States. Based on the success of the 100,000 Lives campaign, a new standard of care began to emerge. and the nationwide goal was broadened. Washington Hospital is currently participating in the 5 Million Lives campaign. It's an ambitious goal to protect patients from 5 million incidents of medical harm from December 2006 to December 2008. Hospitals across the nation are on track to meet or exceed that goal. What does this mean for our patients and the community? It means that Washington Hospital's physicians and caregivers are using proven best practices when providing care. In fact, Washington Hospital was one of only a few hospitals to participate in every portion of the 100,000 Lives campaign, and serves as a mentor hospital by providing support, advice, clinical expertise, and tips to hospitals seeking help in their implementation efforts. Quality is at the core of everything we do at Washington Hospital. But here are some of the specific programs we have in place to ensure that our patients receive the best, safest care possible. Our Please Ask campaign is designed to educate and encourage patients to ask questions of the staff if they do not understand something about their care, including their medications. Closely aligned with the Please Ask program is our Rapid Response Team, consisting of a respiratory therapist and an intensive care unit nurse, which is charged with assisting and evaluating patients if their conditions change. Patients and their families are encouraged to dial O for operator to request the Rapid Response Team at the first sign that a patient's condition is worsening. Patients in the hospital's emergency department vary in the complexity and seriousness of their conditions. Rather than having the same process for all types of patients, the Fast Track is a separate process for patients with less serious conditions who can be treated more quickly and then released. This allows for a more flexible and efficient use of staff and resources to deliver care to all patients in a timely manner.
There is a legend for the quality report, and you will see as we move along that
Washington Hospital provides televised quality reports at monthly board meetings. Those reports and the discussions that follow are available to the public. We also offer one of the most innovative community education programs anywhere on Washington Hospital's InHealth channel. Programs on a wide variety of hospital and health-related subjects are broadcast throughout the day on Comcast Channel 78. Washington Hospital's commitment to quality in all we do is an ongoing and ever-increasing effort. We're currently exploring other technology-based solutions that will make the delivery of care even safer. Among these initiatives are bedside barcoding, which will improve the accuracy of medicine dispensing, and physician order entry, known as CPOE, to help safeguard against transcription errors. Washington Hospital is committed to implementing systems and practices to help ensure patient safety. We understand that making improvements in patient safety is a continuous process that must remain an important part of our culture. If you're a patient at Washington Hospital, chances are you might never see our pharmacy department verifying your medications before you receive them. You might not realize that the doctor and nurses are double and triple checking your name and the type of procedure you're having, or your medication dosage. But you can rest assured that plenty of finely tuned quality procedures are at work in everything we do. Even though much of our commitment to quality goes on behind the scenes, there are some very critical and noticeable results: better outcomes, shorter stays in the hospital, and quicker recoveries for our patients. And that can mean a healthier community in which we can all live and prosper. To learn more about what we're doing to ensure patient safety and to provide the highest levels of quality health care, visit our website, whhs.com, or tune in to InHealth on Comcast Channel 78.